Welcome to the Perry Health Pulse. I'm your host, Dane Steyer, and today we're excited to have a very special guest who's here to shed some light on some issues that rural communities especially seem to be facing and talk about what he's doing to help address that and what we all can do to help address issues like this facing seniors and veterans. So stay tuned for the conversation with him. As a reminder, you can always give feedback or topic suggestions, access all of our podcasts and blogs and everything if you just go to www.perrymemorial.org/pulse. It has all the features right there, and they're very easy to access and use. Now let's get to the episode. Today our guest is Representative Dan Swanson from Illinois. He was a veteran for over 27 years and is now serving in the 74th District in Illinois as a state representative. He's been serving since 2017. And so he's here. He's going to be talking about kind of the current situation of healthcare, rural healthcare, and a resource fair that's going to be going on later this month. And he's also joined here with Marshann Entwistle, who is his Princeton legislative aide. And we're excited to have them here. Thanks for joining us.
Well, thank you very much, Dane. It's always a pleasure to get opportunities to talk about many of the issues facing the district here.
What do you see as some of the issues that rural communities are facing with healthcare?
The education piece is a big part of awareness. I think some of the navigation through the healthcare system and navigation through some of the things available for housing or medical care and just mental health, navigating and finding out where do I go, who's my resource that can help me with those types of problems that I might be experiencing in my own household or with my spouse or with my family. There's different organizations trying to help help our seniors and our veterans, but people just aren't aware of their availability.
Well, and I think we see here a lot how much of a challenge it is to get people out of the old mindset of you go to the hospital when you're sick and you wait until then to go, but there's so many other problems they're facing that can be addressed early with the knowledge we have now.
Absolutely. With, as you said, the information knowledge we have today of, we've been having some of these same experiences year after year. Let's get the preventive part done. Let's do the treatment early. Let's take care of our aches and pains early before they fester into something that may require overnight stays in the hospitals or more medical care than was actually necessary.
Do you see that affecting rural communities more than urban ones across the state?
Well, I think it does, just because of the education, the availability. Here in Bureau County, we're fortunate to have rural transportation through BPART. Some counties aren't as fortunate, but there again, it's the education part. When can I get services? When can I use a van? When can I do? Is it handicap accessible? All of them are, but are those some of the things that people aren't aware of that is available for them as another resource?
Your focus lately has been more so on seniors and veterans. Is that right?
Well, it's certainly this is my third veteran senior fair. And as we progress through each one of these, we're learning more and we're inviting different people, vendors, based upon the information we're receiving from those who are coming through our show. Where's this person? Where's that person? Well, then we go out and recruit that person to come to our next vendor show. And, we're so happy this year to be partnering with Perry Memorial Hospital and co-hosting our Veteran Senior Fair this year.
It's going to be great. We're very glad to be involved to provide some of our resources as well. And along those lines, with that focus on seniors and veterans, what is it about those demographics? They don't have access to those resources or don't know about them. What is it about that?
Well, I think you're young. I like to consider myself young. And we navigate the internet. Many of our seniors and veterans don't understand the internet. Where do we go for our information? The first thing we do is we Google it. Where can I get this or where can I get that? Well, many of our seniors don't have that accessibility or availability to understand the internet. But, how many times have you said, well, it's on the internet. Can't you just Google that? And then you realize, well, that was my grandparents I just said that to, or something like that they don't have that access or understanding. And, we just need to be more educational and presenting that information. And one of the things I've learned about the senior fairs when I make the introductions or kick it off, I said, what's so rewarding to me is when I see veterans and seniors walk out with a bag full of information. But one of the things we don't understand that happens too is those vendors are networking themselves, finding out what each other has to offer, and then they're trying to find that area that's maybe not covered where I thought you provided that vendor. Well, I thought you did. Well, now we're finding those gaps in coverage for our seniors and veterans and anyone else who wants to come. But that's the knowledge, that networking is so important within our communities too, to understand what each other is providing as far as services. But, going back to your question, I think it's just some of the accessibility of through the internet, like I said, of finding out where the information's at.
Now, we, as a hospital, I know a lot of hospitals use a community assessment to gauge what are the needs in the community, what's lacking that needs to be addressed. Over the last few years, we've done a lot more with mental health because of that, with that being becoming more and more of a need all the time. So we change and adapt. And wondering from your perspective, does Medicare, Medicaid, and programs like that, are they adapting to the needs?
Those are big beasts. They're not adapting as fast as they should. Consider making a U-turn with a speedboat compared to an aircraft carrier. Takes a lot more maneuverability and a lot more time. There's been some recent legislation to kind of, or not kind of, but to, the Medicaid process is so long. And so many people, when we get phone calls in our office, that's a big one, is how come my Medicaid hasn't been approved yet? So there's been some legislation to speed up that process. Instead of having to wait 3 to 4 or 5 months to become eligible within a time pattern, I believe it's 30 days, a provisional is issued so people can begin their Medicaid sooner, because we do understand it's a long process. And that was Representative Hammond who introduced that legislation 2 years ago. There's stacks and stacks and stacks of papers on the desks of the Medicaid people. And that's probably one of the biggest issues we fight is helping to get the Medicaid process sooner and draw attention to someone who's been going for months without coverage, who all of a sudden was dropped. That happens often. Is how come I was on Medicaid for 3 years and now I've noticed the last 3 months there's not been any coverage? How come? So then we get involved and make some phone calls and find out that, yeah, you were dropped, but we're going to re-enroll you and we'll go back to that time that you were dropped. So yeah, Medicaid is a big issue. Medicare is more of a federal issue, so I don't deal much with Medicare, but I've got some good federal contacts. Those are more federal issues, and there are issues and problems out there.
Well, and when those issues arise, or when people have ideas for how the system can be improved, how is it that people or organizations such as hospitals can work with representatives better to get good changes in place?
There's 3 ways to, as I tell the students when I go to different schools, 3 ways to get legislation or ideas presented. One is through a state agency presenting that idea that we need to do this. Myself coming up with an idea, or that congressman or representative or senator. Or the third way is from the constituents. Most of my legislation I've had passed through the House, Senate, and the governor signed has come from constituents. They're the ones with the ideas. They're the ones, and that's why I try to be so visible so people feel they can come to me and talk to me about these different ideas and concerns.
Exactly why you're having events like what's coming up on July 24th. I know you're traveling all across the state. You're hosting multiple of these events just so that there's more access, more reach around your district. And we're proud to be hosting one with you here in Princeton at the Bureau County Metro Center on July 24th. I was wondering if you could talk some more about what's going to happen there.
Absolutely. Those have been successful in the past. I'd like to encourage people to come out and just see what we have. I've picked up a couple more state agencies this year. The Attorney General's office is going to come out and have some information about identity theft. Of course, the Treasury's office will be there, and I'm working with some other state agencies to try and get them there, but they've been very receptive to come out. We've invited the Secretary of State's office out to talk about some of the new driving laws and things. And of course, we've got a lot of local vendors, CPASA, of course, the hospital, our veterans groups, just a long list of people. I think right now We're probably close to 20, and it'll be at the Metro Center. And this time it's from 3 p.m. to 7 p.m. A little light lunch too to provide everyone. So looking forward. It's a great event, and there's just so much information that is available. And like I said, it's neat to see people walk out with a full bag. I've got a lady coming from Mercer County who has been a strong advocate on Lyme disease. Her daughter has Lyme disease. She'll be here again this year. I helped her we passed 2 pieces of legislation because of her 13-year-old daughter who has Lyme disease. So it's going to be a big event.
And this is mostly geared towards seniors and veterans. Can other people benefit from this?
Oh, absolutely. Because of that network of information we're going to be sharing, veterans come of all ages. And so we're trying to target everyone with this event. So, yeah, everyone's invited. When we talk about Bureau County of 2,500 veterans alone, estimated here in Bureau County, that's a big crowd. And not only veterans, but the spouses. Come with your veteran because there are spouse benefits available also. Come learn about those. Come learn about some of the health care, some of the mental health, some of the many other things, the finances that can be helped. At the local level, our seniors need to be aware of the homestead exemption requirements and then the property tax freeze. I believe this year the state changed that homestead exemption, and everyone needs to be aware of that to take advantage of those changes. And it's certainly something that we have invited the Bureau County tax assessor to send a representative to help people navigate through that system on a one-to-one basis.
Well, and there's a lot of stuff that's now online that it's easier, it saves paper, you don't have to mail it. So a lot of stuff's moving that direction, and being able to navigate it can be challenging.
Yeah, driver's license, for example. You can go online and get your driver's license renewed. Well, that's easy for you and I. But if you're older and not used to using the fingers and using the keyboards and understanding how to navigate through the internet system, it just becomes frustrating. Not that we're going to be able to provide the help there, but we'll certainly take in the information. Right now, Julie in the Woodhull office, Julie Dilley, she's been handling 3 to 5 phone calls a week for people with their FOID cards, their firearms owner identification card, or also their concealed carry license cards. Many seniors cannot get on the internet or understand the internet to do an application. So feel free to come out and present issues like that, and we'll take down the information we need and we'll look into it for you.
Free event, people should definitely come out then and just gain that knowledge about a system that just keeps changing, and there's so much available that you might not know of, and you can just learn about what's out there.
Absolutely. Like I said, it's about education, about awareness and learning and that. And we're going to have some little breakout sessions this time too to give the vendors an opportunity to talk a little bit more in depth with those who want to specifically hear about some of the things they have available. Like I said, 3 to 7 p.m. on July 24th at Bureau County Metro Center, and I'm honored to be able to host this with Perry Memorial Hospital.
Well, thank you so much for taking time to be here and share great information and help promote an event that's going to be just a fantastic resource.
I am offering 4 of them throughout my district. July 23rd, we're going to be holding an event at the Mercer County VFW from 10 to 1:30, and we're co-hosting that with Genesis Medical Center in Brookstone of Aledo. Of course, we're here July 24th. July 25th from 10 to 1:30, we're at the Knights of Columbus in Galesburg. And July 26th from 10 to 1:30, we're at the Moose Lodge in Geneseo. So if you can't make it here in Princeton, or if you live closer to one of those sites, please feel free. We're not checking IDs when you walk in. We don't care where you live, but just come in and get some information.
Fantastic. Thank you. There you have it. We've got a great event on the 24th coming up. One thing I do want to add about the event is that Perry Memorial Hospital is going to be providing a lot of vendors or a lot of stations with information with various departments, a lot of our family providers who are getting involved to help give presentations and keep people informed and connected to the resources that we have available. But also, Princeton Rotary has been very generous in working with us and is helping us bring an iron lung exhibit. That's right, an actual iron lung that used to be used. We're going to have a podcast coming up about that discusses what those were for, what they were used for, and why we don't use them anymore. But that exhibit's going to be there, so there's stuff for people of all ages. We hope, at the very least, bring your kids, your grandkids, look at the iron lung, and get great information. We hope to see you there.